Good morning, everybody. Welcome, welcome. I can't see you all because of the agenda up. It's really nice to see you all. Happy Friday. Hope everybody's well. We got 3 speakers today, which we're really pleased about. I want to thank you all. We were starting with Hamza. I can see you. Would you like to say hello to everybody?
Hi everyone. Can everyone hear
me? Hamza is the engagement officer for the NHS Diabetes Prevention Programme and has been kind enough to do a presentation for us. And then after Hamza, we've got Eva and then Shamak. Eva's the marketing officer for Ealing Council and Shamak is from Gossard Charity. So we're really delighted and thank you all very much. And before we start, I'm just going to do a little bit of housekeeping. Could you move the thingy over, please, Ian? So the session isn't 2 hours long, it's an hour and a half long, and we won't be having a break. If you aren't speaking, if you could please just mute, because sometimes we get sound disturbance and when we can't hear the speakers talk properly. It would be great if you want to connect with people after the meetings, if you could share your details in the chat box so you can connect after the meeting. And if anyone likes to speak, because there's quite a few of us in this meeting, if you just raise that little iconic hand, Ian or I will make sure that, that we give you a chance to ask questions. Is there anything anybody would like to bring up before we start the presentation? Okay, lovely. Hamza, it's a pleasure to meet you. Thank you so much for your time. Ian, if you could put up the presentation, that'd be amazing. Thank you so much.
Thank you. It's a pleasure to be here too. Lovely. Cool. I was just wondering, is it possible if I just share, oh, I can't share my screen. I was just wondering, is it possible if I can share my screen so I have control so it's a bit easier?
Yeah, you should be able to just go to
absolutely.
Share screen at the bottom. Desktop.
Cool. Can everyone see that?
Yes, we can.
Fantastic, lovely. Well, hi everyone. It's really nice to be here. It's a good day. It's Friday. Blessed day, lovely. Hope everyone's doing really well. And today, for example, I just wanted to speak to everyone about the National Diabetes Prevention Programme, and it's a free NHS initiative. And I'll go down into the details just now. So what we're going to talk about today is who I am in particular, what I do, what we do at the NHS Diabetes Prevention Programme. We're going to look at what prediabetes is. It's a condition that we probably may not have heard of, probably. And then we'll look at the burden to the NHS, the problems it's causing, especially with type 2 diabetes. We'll look at the BAME community in specific, what the risks are, especially in relation to COVID. We're in trying times right now, and I think that's quite important. We'll look at the eligibility criteria for someone to actually be able to, get involved with this program. And then we'll just, look at some of the program structure, the outcomes from previous service users that have actually attended the program before, and then how you can actually refer yourself onto the program, and then Q&As, which is always an interesting one. So feel free to ask any questions in relation to this program, and I'll be more than happy to answer. So first and foremost, Xyla Health and Wellbeing. I work with Xyla Health and Wellbeing, and they've been the provider for this program since 2016, since it was actually created and rolled out. And we currently actually provide the service for all of London and most of England. However, the Diabetes Prevention Program is available across the whole country, and it's free. So the program itself in particular, it provides lots and lots and lots of information, but in specifics, it provides you support when it comes to dietary improvement, physical activity, and more importantly, exercise, and we'll get to that in a second, and just overall general healthy lifestyle improvement. And our particular focus with this program is behavior change, and I'll be talking about that in a couple slides' time. And currently, annually, we're treating around 100,000 people when it comes to this program, but we're trying to expand that to double that to 200,000 since the NHS have now looked at their long-term plan, and we're really trying to focus on prevention of diseases rather than actually managing them in the first place. So what is prediabetes? Well, prediabetes is a condition where your blood sugar levels are higher than normal, but not high enough to essentially be classified as type 2 diabetic. All right. Now, since 2003, there was a study conducted then, and we found within that particular study, there was around 11% of people within this country that were prediabetic. Now, 10 years later, we conducted the exact same study, and we found out that that number rose from 11.6% to 35.3%, which is staggering because that tells you that 1 in 3 adults may be suffering from prediabetes. Now, what I can say since then, because that is almost a decade on now, it's 2021, we don't have a new study. And I'm assuming we'll conduct a new one in 2023. And there have been lots of suggestions, particularly within the research, that the number has possibly risen within the last 8 years. So when the new, if a new study does come out and I'm able to be here, I would present that information to you. But what I'm suggesting is that there are more people that have been, diagnosed or living with prediabetes and don't know about it at all. And many people are actually extremely unaware to what this condition is. It's essentially the stage before someone gets type 2 diabetes. Now, prediabetes is a reversible condition. However, once your blood sugar levels rise to the point of type 2 diabetes, you cannot change it. It's for life. That's the biggest problem. So that's why my role here at the NHS Diabetes Prevention Program is to focus on prevention. Now, just a bit of statistics here for you. Almost 3.7 million people have been diagnosed with diabetes in the UK. All right. However, 12.3 million people are at an increased risk of type 2 diabetes, and that is in relation to the pre-diabetes numbers I was talking to you about earlier. Okay, that's 12.3 million. And then finally at the bottom, 4.6 million people are living with diabetes in the UK. Now, what I'd like you all to do is, if you just look at the first figure and then look at the third one, the final one, okay? What you'll essentially find is, what this is meaning is that there are 900,000 people within the UK living with type 2 diabetes and have absolutely no idea about it, which is a massive problem. We're going to talk about that in a sec. So when it comes to the NHS in particular, the NHS spend around £14 billion every year on diabetes care. That's actually 10% of the budget. All right. Now, 1 in 6 people who are hospitalized do have type 2 diabetes. That's 1 in 6. And they generally do need to stay longer in the hospital, which is costing more to the NHS. And at the same time, they may need to be readmitted due to their condition, and at the same time also have a greater risk of death. And many people actually will experience these preventable complications from type 2 diabetes. And that's simply because they don't know how to manage their condition. They weren't aware of it in the first place. They don't know how to manage it. And they had no idea how to take measures to be able to prevent themselves from actually developing the condition in the first place. And then just in relation to the BAME population, now the BAME populations are up to 6 times more likely to develop type 2 diabetes than individuals from a white ethnic origin, okay? And having pre-diabetes, and more notably type 2, actually increases your risk of complications from COVID-19 and even early death, unfortunately. So when it comes to this first one, I always get the question of, well, Hamza, that's a nice figure there, but do we know the reason why that may be the case, why we may be up to 6 times more likely to develop type 2 than other people? And I get that from BAME populations all the time. And the answer is simply generally due to the fact of cultural norms. So, for example, things like food. All right. Generally, that is the answer. And when it comes to you know, what type 2 diabetes can essentially do to you. It can cause a number of different issues. So for example, if someone develops type 2 diabetes, at the same time, you may find them, you know, very generally about 80 to 85% of people will be suffering from high blood pressure, hypertension at the same time. You'll be at risk of things like atherosclerosis, heart attacks, heart disease. The most 3 common symptoms of type 2 diabetes is things like losing your eyesight, okay? Yeah, so eventually it leads to blindness. Secondly, kidney disease. And thirdly, issues when it comes to, for example, your neurological system, okay? So it will cause issues, for example, with your movement, yeah? And eventually what we do see is that people have to get amputated, specifically with the legs, due to getting ulcers. And wounds take far longer to heal than normal, far longer. So it doesn't have to be you though. All these horrible things I mentioned, we're here to help, okay, with this free NHS program. And when it comes to this program, what we do is we'll aim to provide you with the knowledge, skills, and tools that you need to make these healthier choices for yourself to reduce your risk of diabetes. Okay. Now we offer a number of different things at this program, but we provide a mixture of nutrition-based sessions, physical activity-based sessions, and behavior change-based sessions. And that behavior change I'll talk about in the next couple of slides. I know I keep saying that, I just need to wait on that. But we will guide you through the whole service, you know, with all the support you need. We have psychologists at hand, we have dietitians, doctors, you know, diabetes practitioners. We have everything you need. The only thing you need to do is find out whether or not you're at risk of diabetes, get yourself on the program, and help yourself where you can to prevent yourself from developing that horrible disease. So the eligibility criteria, okay, that's always an interesting one. So in order to be eligible for our program in particular, okay, our members need to be 18 years and over, okay, that's the first thing. You have to be registered with a GP practice. Your HbA1c result, which is a type of blood sugar reading, okay, that needs to be between 42 to 47.9 millimoles per mole, or your fasting plasma glucose, which is a different type of your blood sugar reading, however, it's still measuring your blood. This result needs to be between 5.5 to 6.9 millimoles per mole and dated within the last 24 months. Okay, so both of these measures can be used and they have to be dated within the last 24 months. Okay, your last result. However, if the patient has a history of gestational diabetes, which is very common amongst pregnant women, then the patient is eligible to enter the diabetes prevention program without having to, you know, have these blood sugar reading requirements. All right. And then the last two, not being pregnant. And the most interesting one of all for me in today in particular is receiving a score of 16 plus on the Know Your Risk tool. And that's actually a very quick, easy 2-minute questionnaire that the NHS have created. And it's actually a temporary COVID-19 process. And we have this going on till about September, because we know the GPs are, you know, a massive stretch right now. They're very, you know, overworked. They have a lot of work to do when it comes to COVID-19. So this is essentially easing the burden on them, at the same time allowing people to get the help they need, okay? So, bit of the structure when it comes to the program. So firstly, when it comes to initial assessment, what will essentially happen is people will go through a program overview, okay? We're not going to let you go in straight blind, you know, we want to know what you're getting into. So we'll give you an idea about the program, step by step, okay? And then after that, what we'll do is we'll essentially assess your needs, your individual needs, okay? What kind of support you need. For example, if you may need a language group, okay? And by that, I mean, for example, we host these groups not only in English, okay? We have them in lots of different languages, to name a few. We have Tamil, we have Urdu, we have Punjabi, we have Somali, we have Arabic, we have Polish, we have many, many different languages. So we support individuals from all sorts of backgrounds. When it comes to the actual sessions themselves, okay, how you'd actually access them, usually they would be face-to-face, okay? However, what we've done through COVID-19 is we've, you know, started to do sessions via Microsoft Teams, which is exactly like Zoom, it's just on Microsoft. And then we have Fuse, which is that other logo. Now, Fuse is essentially a mobile service for people who don't have access to the internet, okay? So essentially you'd be able to just dial in, but I know for you all to be here, you'd have to have access to the internet, so that doesn't apply to you. So Microsoft Teams is essentially like Zoom, and we'd use that application over the course of the program. And then finally, we'd have that end of program review, which is essentially a one-to-one review. Okay, and what that would do is it will allow us to, assess your progress, how things have gone throughout the program thus far, any individual needs that you may still have, any possible support you need. We'll also ask for your evaluation as well. And that's very, very important because we take into account everything that our services say. We really do. And if there are any issues or anything that you think that we can, improve upon, we're always willing to hear that and change that and moving forward in the future. All right. So just in particular, so for example, we have 5 eating well-based sessions, and these are nutrition-based content, okay? And within these sessions in particular, we'll go through a number of different things. So for example, we'll be looking at what a balanced lifestyle is. We'll be looking at portion control. We'll be looking at carbohydrates. We'll be looking at, food labeling. We'll be looking at food shopping. We'll be looking at how you can work out, for example, how many calories, carbohydrates, and proteins and fats you'll need in a day, for example. And then we'll also be looking at, for example, moving more. Now that's the physical activity-based content. In particular, which is quite interesting, did you know there are 4 different types of exercise? Okay. And we'll go through each individual one in these sessions, okay? They're over an hour long. That 50 minutes at the end is more so to do with the questions at the end. But they're over an hour long. We'll look at, for example, the calories you'd burn if you're walking, running, biking. We'll be looking at, for example, how to instill behavior change, which is that's taking charge sessions. And by behavior change, that's for a lot of us, we may not have heard of that. I simply hadn't heard of that before, a couple of years ago. And essentially what that is referring to is trying to instill behavior change over the long term, because when it comes to habits, for example, it can be very difficult to maintain them and instill them. So for that particular reason, our program is 9 months long, okay, to be able to provide you with that support over the 9-month period. Okay, because although we do want a quick fix for lots of things in life as humans, it doesn't work that way, unfortunately, when it comes to our behavior. So we need that 9 months. It's very important, but like I mentioned before, don't worry. We'll provide you with that support and that help along the way anyways, okay? So you're not alone over that 9-month period. But in relation to that behavior change, we'll cover a number of different things. We'll cover habits, okay? And what we'll do is we'll go through a habit change cycle in particular. I'm not going to talk too much about that because that's the program content, but we'll cover that. We'll go through the problem solving cycle, which is how we, alleviate problems. And we'll go through, for example, within the session, for me, if I was delivering a session, I'd go through an example with all of you. So for example, I'd say to Ian, okay, well, what problem do you have in particular currently right now with your behavior? You tell me an example and we'll run through one and we'll try and change that for him, and then vice versa for each individual. So we help each other in lots of different ways, and that psychology-based element is always very, very nice. We'll also be looking at sleep. Okay, how can we get the best sleep? What is the best sleep for us? And there's many other questions that people ask. And then we'll also be looking at stress, and we'll go through lots of different exercises to alleviate your stress, where you can use these exercises on the go, on the bus, at home, before you sleep. Many, many different ways. All right. So just some outcomes from service users. So since 2018, over 81,000 service users have lost an average of 3.5 kilos over the course of the 9-month program. And we've got 3 examples here of some service users. So one of them said, I felt incredibly supported throughout the whole process, not only from my coach, but also from my group members. Second person said, I've always been interested in healthy eating. I had no idea the impact simple carbohydrates had on my health. And then thirdly, I wanted to share my experience to show others that preventing diabetes is not as hard as you would think. All right. So this is going to be an interesting one. What I'd actually like us all to do is, because I know you can all see this, I'm going to copy and paste this, and hopefully I'll be able to send this over to the chat. And I actually want everyone to try and finish this. So can everyone please go to the chat box, click on that link, scroll down, and it should take you to a questionnaire. And I'd like you to just fill that out. It will literally take you about a minute or 2. So what I'll do is I'll wait about a minute or 2 for you all to have a go. Don't need to tell me what you get on that. Don't tell me your score, but just have a think about it for yourself. Okay. Cool. I'm just going to put a timer on for everyone. Cool. So just about another 30 seconds, everyone. Fifteen more seconds.
Oh.
Not to worry if you don't know your measurements, that's fine for now. You have the link there, so when you do have your measurements, you can just take that Know Your Risk tool, that questionnaire again. So don't worry either. Cool, and finished. So if you're still doing it, feel free to continue. Honestly, there's no rush. But hopefully you would have been able to see whether or not you're at risk of type 2 diabetes, what your score means for you. If your score was 16 plus, okay, you would be able to directly refer yourself onto the program, because what it would do is it would, as soon as you finish the test, it would show you your score. And if you had 16 plus, it would redirect you to a new website, well, the same website, just a new link. And you just fill out a couple of your personal details, click enter, and then within the next couple of days, one of my colleagues will essentially give you a call and arrange, an initial assessment to be able to get you onto the program and get the support that you need. All right, to prevent this condition from happening in the first place. So what I'd like you all to do though, please forward this to your friends and family, that particular link there, okay? I'm sure you love them very much, so get them the help they need if they do need this program, okay? I mentioned before that type 2 diabetes is costing the NHS 10% of its budget. Although we're talking about budget here, we also need to, take into consideration the lives at cost, okay, and the lives at hand. And there are many and plenty, specifically in type 2 diabetes. It's the #1 chronic disease on the planet when it comes to issues and death. So we need to fix that. All right. So all in all, thank you very much for allowing me to be here today. It's been a pleasure. I was just wondering, does anyone have any questions in particular?
May I ask a question?
Yeah, sure.
Sorry, just put your so I'm a coach of a swimming club, and I'm very interested in us doing some outreach and actually linking with the NHS a little bit more. And I've embarked in the training program for social prescribing. I know swimming works wonders with a number of ailments, and helps with weight control. And I think it would fit in perfectly. Do you have any swimming sessions that you offer, and would you be interested in maybe discussing that with me?
So when it comes to swimming sessions in particular, we don't offer swimming as such. What we do is we do talk about swimming quite a bit, actually, in terms of its effects, and its effects are fantastic. I'm more than happy to have a conversation with you, Lisa. May have to bring one of my other colleagues about that as well, but I'm more than happy to give you my contact email. Sorry, I was going to say address. And I actually have it here. So what I'll do is I'll leave that there. So you can just take that down. Feel free to send me an email and we can have a chat. All right?
Yeah, perfect. Thank you.
No worries. Thank you.
I've just, can you hear me?
Yeah, I can hear you very well.
I've just filled in this form. I said that I had no diabetes, but I'm not quite sure. I mean, you never know.
Yeah.
And I mean, it doesn't recognize some. This field is required, and this field is required. I don't know it by heart. I mean,
What fields are you referring to? Sorry.
I think it is my GP. You can find your score. I mean, if I have no diabetes, how can I find my score? Preventing diabetes, I don't know really see. And the GP it says it comes back with 123 Station Road. Quite frankly, I know where the GP is. I go there straight away. But I don't know his address by heart. I think it's not Southwest 1A.
What I would do is, Beats, what I would do is I would go on Google, just type in your GP's name and all the information.
So. Yeah.
All the information will come on the screen in front of you. If you just do a quick Google.
Okay, I think I've got a leaflet upstairs in a drawer. I can quickly.
No problem.
What else do I need here? Risk score, I have no clue.
So your risk score is the score you got from the test you just did.
Oh, okay,
that little questionnaire, okay?
Okay, I just try to find the address. Thanks.
No worries, thank you. Anyone else?
There's quite a few hands up. If you could take down your presentation, only because I can't see everyone's hands. I can only see you.
Sorry.
No, don't apologise. I just want to say that was amazing.
No worries.
I did my test as well, and apparently I might have diabetes. So I'm going to go and check with my doctor. So that's really useful. But if I can, Rahila, I think I saw your hand first, and then Shanjit. You're on mute, Rahila.
Yeah, hi.
Hi there.
Hi, my name is Rahila. I'm the founder of Organization Center for Human Development. We work with BME community, particularly BME women.
Okay.
My question is how you engage with BME women, particularly from Afghanistan, Bangladesh and Pakistani communities who are working with extended families, ignoring their health because they are much focusing because they live with extended families, having so much work to do. How you engage with those communities so that they can, have these tests and get involved. This is the question.
So when it comes to BAME communities, I'm going to go to the women specifically after, but when it comes to BAME communities, how we engage with them, so it'll be easier that way. Currently what we're doing, for example, is we're doing lots of faith work in terms of, communication with faith leaders, etc. And we're trying to get ourselves involved in as many community groups as we can, particularly in the BAME community. When it comes to women, for example, we have lots of different groups. For example, I know one of my colleagues, and she's working with a mother's group, and they're obviously really well extended, and they connect themselves with many other community groups. I don't have the names off by heart, but we are looking into women's groups as well. But I haven't actually heard of your one in particular. So it would be really nice to be able to connect with you and be able to maybe speak to your group and advise them and allow them to ask me questions and present maybe in a different way. And the other thing I was going to offer you all was the possibility, if you wanted me to, was to essentially deliver a taster session in the future to be able to allow you to see what exactly you would get yourself into. And then hopefully that would be enjoyable. Does that answer the question, Rahila?
Yeah, it does. But again, working with faith groups, most of the women, they don't visit, they don't go to these mosques or temples or whatever. So that's the thing, how at that time you engage with those women who don't visit these faith places or these worship places. Yeah, so, and, engaging with them on ground or working with BME women, because as an organization working for 2 years in Feltham, we haven't been approached anyone from the, organization or from the organization which you work. So that's why we even are more interested, keen to work with.
Yeah, I would love to work with you. So feel free to, put my email address down. What I'll do is I'll quickly actually just get that up for you and put it in the chat for anyone who wants to ask me any questions or get in contact with me. All right. So yeah, Rahila, feel free. No worries. So feel free to send me an email. I would love to get in contact with you.
Yeah.
Anyone else?
Shanjit, would you like to speak? I think you've got your hand up, and then Rosita.
Yeah. On the
the survey, it says you don't have a diabetes, but people do have a diet controlled diabetes. It didn't give us an option to fill in.
Okay, so let me just clarify with the questionnaire. So it's not to tell you that you have, when we say diabetes, we're more so referring to type 1 or type 2. It's essentially allowing you to see whether or not you're at risk of diabetes. Okay.
We are.
Okay.
So it doesn't give me option to say, yes, I am.
Yes, you are type 2. If you're a type 2 diabetic, you wouldn't be able to come onto the program. This is a prevention program. So
Yeah. I mean, this is for diet control people I'm talking about.
Sorry, could you tell me the question again then? I'm sorry, I confused myself.
Shajit, where are you going? Still.
I've got so much to do today. I'm not going anywhere yet. Not yet. One of the question is when we were filling up the survey, it says you are not type 2 diabetic and click. And if we are diet control diabetic, then we can't click, can we?
No. So if you currently do have type 2 diabetes, you can't join the program. Okay. It's only for people who don't have type 2 diabetes. However, if you do have type 2 diabetes, and you haven't, for example, taken part in the Desmond program, which is another program for people who do have type 2 diabetes, then you can essentially, I believe you can refer yourself onto that as well. So what I would do is I would go on Google and I would write DESMOND, all capital letters. So Desmond type 2, and then click on the first link. Alternatively, maybe speak to your doctor about that and ask your doctor, am I able to enlist myself onto any programs, any support programs?
How much doctors have a time to listen to the patients?
Well, I do understand what you mean, but it is literally a 30-second question and answer, whether or not you can get yourself involved in the program. And it's very quick. All you need to tell them is, can I get myself onto this program? If you can, they will put you on there. It takes them a minute to do that.
While you are here, why don't you add people onto the program?
I can't essentially just do that. It doesn't work that way, unfortunately.
There we go. I
wish it did.
Talk only.
I wish I did. If I had the power to do that, I would.
There are so many people into their 40s, especially women. They come to my yoga exercise. I'm from Sunshine of Hounslow. We deliver a lot of activities for women and mixed men as well. There are so many people who becoming type 2 diabetic from the young age as their hormonal change about 40s and the 35s as well. These are the people need to be considered and need to be looked after from now before it get worse for even for the NHS and for the community as well.
Yeah, which is why we're really focused on prevention now rather than actual management.
Right. I would love to invite you in my group session. We do
fantastic.
have a chat.
Yeah.
And could we have your direct email address and contact number as well, please?
Of course you can. So let me, before I take any other questions, let me just put that email address in the chat.
Sure. Thank you.
Thanks, Hamza.
No worries.
Thanks, Shajit. We've just you put that in the chat, and then Rosita, you've got your hand up as well.
Cool. There we go. Cool. So I think it was Rosita, wasn't it?
That's right. Yes.
Yeah.
Yes. I wondered whether it was possible to put the question about weight in kilogram as well, because the education system now is in grams and kilograms, and I have no idea, for instance, how many pounds I am. I would understand kilograms more. I know that I am old but educated in a different environment.
Yeah.
I work with kilograms. So that's one question. The other one is, how long can one stay in this program? For instance, if you are not making any progress, are you discharged from it? And how can you self-refer to the program?
Okay, good question. So the first one, what was the first one again?
The first one was about people who are not making any progress. Yeah, the pound and kilos one. Yes, that was a comment. Yes.
Yeah. So the pounds and kilos. Are you referring to that questionnaire that you were filling out?
Yes, yes.
I believe you can change it to kilos. I believe you can. If not, what I would do is I would simply just go on Google and just write in however many pounds to kilos and it'll come up.
Yes, but the question about your waist length, that is given in centimeters.
Yeah. Okay. No. Yeah.
Yes. But
Yeah.
why is it that when it comes to your weight, it's only in pounds? So, I mean, it's up to you. I think it would be more convenient if young
It would be more convenient if the metrics were, towards how we all use them now. It's a bit of hit and miss, isn't it? But it's not something we can change as of right now. But it's a good question, and I will definitely.
If there was a thing on the right. If you clicked on that, it would change it into kilo.
Yeah. So just change them.
Mine in kilos.
Yeah. So change your metrics there, and you should be able to.
Okay.
And the second question. Sorry, what was the second question?
The second question was about if people are not making any progress regards to their weight loss, are they discharged after a certain period of time, or is there a maximum number of months or weeks that you can stay on the program?
Okay, so that's a good question. So when it comes to discharging and people going on and off the program, so for example, if you find yourself getting yourself onto maybe session 3 or 4, and you're thinking to yourself, well, maybe this isn't for me right now, or I've got a lot of commitments, I'm not able to stay onto the program right now in particular. What we can do is we won't discharge you, okay? We wouldn't discharge you, but you'd be able to, come back to what you were doing, or you'd be able to, fix your issues or whatever the situation may be, okay, and come back to us. But we wouldn't discharge you, and we'd be able to provide you with those sessions that you attended already. For example, maybe the first or the second, we'd possibly be able to provide you those sessions again, okay? So you wouldn't actually feel alone. And if you needed any particular support, for example, maybe you're struggling with your mental health, we'd be able to provide you to one of our psychologists, and they'd be able to have a chat with you. All right. And maybe possibly see if there's any further support. But we do signpost to lots of other different services. Like if you do need their support at the same time that you are also attending our program, then we'd be able to do that. Because the best case, of course, would be obviously that we'd like you to stay on this program, but also be able to get the support you need from another service. So we usually do that at the same time.
Fair. And what is the process for self-referral, Hamza? Can you self-refer? Or does it have to be a professional who refers you?
So that questionnaire that I let everyone fill out today, that was more so a self-referral, okay? The question of the health professional, i.e. GPs, dietitians, etc. So the GP would be able to refer you naturally, normally. That would be the normal process. But due to COVID-19, that questionnaire has been able to be produced and distributed, and it's much more easier. So what I would do is, if anyone would like to try and get people to self-refer themselves onto the program, which is the easiest way, of course, then we'd love you to be able to distribute and use that questionnaire. All right.
Okay. And that's on your website?
Yeah, it's on the website. So what you could do is you could go on the internet and just write "Know Your Risk Tool Preventing Diabetes," and it will pop up instantly. All right.
All right. Thank you, Hamza.
No worries.
Thank you. Has anybody got any other questions for Hamza? Oh,
I think it's Yusuf Lalit.
Yeah, also, hi.
Hi there.
Thanks. It's not a question, actually, it's just a suggestion. In terms of the women who are reluctant to come forward from the Afghan and Bangladeshi and other communities, I was going to make a suggestion. It might be, it's nothing to do with you, but it might be easier for them if they had a female presenter.
Good question. So we do offer female-only groups. Okay. We offer groups in lots of different capacities. So we have the language, we have the female-only groups. So depending on what the situation is, we'll provide accommodation for that. We do currently have female-only groups, and we can also possibly provide female-only groups in a particular language also.
Thank you.
All right. No worries.
Thank you. Yusa, you've got your hand up.
Yeah, I was asking your centers of activity and the nearest location in Ealing.
Sorry, could you say
centers of your activities? Do you have centers of activities?
Oh, okay, good question.
And the nearest one.
Yeah, it's a good question. So when it comes to, for example, where we're based and what we do, so these sessions are usually held at GP practices, but we also hold them at lots of other different venues. So we're everywhere. We're literally everywhere. So, for example, if you wanted a location near your house, then we'd be able to provide that. Usually we'll have something maybe within a 10-minute radius, near your workplace if you're a working individual. So we have services everywhere. All right.
Thank you.
No worries.
Anybody else?
Mukesh had a few questions, but he had to
Oh.
leave because of internet issues. So his questions
Okay.
are in the chat. So if you can,
Yeah,
his
sure.
email address, if you can answer his questions and email him back to him.
No problem. So Mukesh. So okay, so I'll go through one by one. So question 3, what are you offering for people with type 1 and type 2? So for type 1 diabetics, we have what we call a DAPHNE program. Okay. It's another education program for type 1 diabetics, and then the Desmond program for type 2. Okay. So feel free to have a search for that. So it's DAFNE for type 1, and then Desmond, DESMOND for type 2, yes. And then what else has he said? Second question is, rather than using Lancets for blood samples, can we not assign more of the smart apps, the device on the arm and a smart app on your phone, as to record the blood sugar levels? So that question in particular is more so to do with, is more of a clinical question, isn't it? I wouldn't be able to actually answer that because I'm not actually working within a clinical setting in that sense right now. Yeah, so no, I can't actually answer that one, the second one. It's quite a vague question, really. If he wants me to do, actually what I can do is I will take his email address and I'll be able to try and see if I can provide the answers for that question as well. No problem. And then he's asked the final question: within the Asian community where diabetes is prevalent, why is it not possible to have insulin pumps assigned to more of the BAME community? I'm assuming that's more to do with the fact that, GPs are assigned a certain amount of insulin pumps, for example, based on their budget. So I don't think it would be easier to be able to say, well, we can provide X amount of insulin pumps to this community and X amount to this. I'm assuming that question is more to do with the budgetary problems. All right.
But we'll send the recording to everybody, Ian, so that he gets that. Thank you so much.
No worries. Thank you, everyone.
Well, it's been a real pleasure. Thank you so much for all this information. I think I'm definitely trying to digest it all.
No worries.
With digesting some very healthy vegetables and fruit as well. Our next speaker is Iva Manova. I've seen you and I can't see you anymore.
I'm here. I think my camera is on. Hi.
Hello. Is it Eva or Iva?
It's Eva, but if you say Iva, please don't worry.
Oh, thank you. Well, Eva is the marketing officer at Ealing Council, and thank you so much for speaking to our fabulous group this morning.
Thank you for having me. So I'm aware I've been assigned with 10 minutes, so I'll try to be quick. I just wanted to introduce you all to a really lovely and exciting project that we are currently doing in the council. As you know, our main motivator is just to help people. So what we decided to do is we decided to assemble only one area, just one section on our website, where we will have something called vital help and support for residents. Because at the moment we have so many pages on our website, so many different sections, so it's a little bit confusing and it's not easy for people to go and see a kind of menu of services. So all the different help and support that they need if they're facing difficulties in general. So they might not have enough money, let's say, which is only one issue and one problem, but actually there is so much support that we can offer to them that we are offering or our partners are offering, that actually they can go and see all this help and support. And if I don't have money, let's say, to pay my fuel bills, then there's so many other things that connect to this. So I might get financial support, I might be referred to a food bank, I might get help with support and employment. So everything is kind of interconnected. So if I very quickly share my screen with you, I hope you don't feel overwhelmed by the information, because it's a lot of information, and I'll quickly go to the different sections so you can just get a taste and a flavor of what we have so far, and I can share the whole document with you later. Just 1 second. So it's a Word document, Please let me know if you can see my screen.
We could see it. I can see it. Thank you.
Oh, perfect. So as I said, I can send this to you later, but obviously at the moment this is a very big project and we're trying to speak to people, speak to partners, speak to other organizations and find out what is missing. It will be a work in progress all the time, but at least we can start from somewhere. So the idea is that a resident of Ealing will go to the website, somehow they'll be referred to it and they're going to see this vital help and support for residents. And then shortly, these are the sections that we have so far. So we are talking about food banks and how they can actually go and choose a food bank. Sorry, I hope, let me just go back. I think I scrolled too fast. So food banks and then advice and help on welfare benefits. So obviously we can refer them. Sorry, I think somebody tried to ask a question. No? Okay, I'll continue. So advice on and help on welfare benefits. Obviously, there's so many resources that we can refer people to. So the idea is that we are going to make it simple for people. So you wouldn't see too much information here. We've tried to keep it very simple. So we basically are saying this is where you can go. So basically, this is another area of Ealing Council's website. So please go to these pages for help. There's some other organizations and some other websites where you can find help. We have a whole team which can offer advice, not only on benefits, but on lots of other issues as well. Also, we have tried to capture people who maybe think that they are not entitled to benefits or no recourse to public funds. So we are referring people to an organization which can possibly help them. And then to other organizations. So obviously, some partners might be missing, and this is why I'm here, just to get your opinions, just to get your help. Maybe you can refer me to another organization that can help people. So just to scroll down, we are listing other helpful contacts, and then the next section is advice on isolation payment. I'm not sure whether you know, but basically quite a lot of people feel very worried to get themselves tested in case they actually test positive for COVID-19. So it's some kind of assurance. We want to reassure them that actually if they stop working, there are a lot of people who don't work from home. You know, they have a job that they have to be, maybe a delivery driver or maybe working in the hospitality or retail sector. So this is just reassurance that we are going to help them with £500, which obviously is not a lot to cover their 2 weeks of work, but at least it's something. And then again, no recourse to public funds. And then the housing help section, which is basically a referral to our other pages. Now, at the moment, if you go to our website, there's so many pages about housing help. So what we have tried to do here is not repeat the information that already exists, but just maybe refer people into the right direction in a more simple way. And then the next section is jobs and training help. So you also might be aware that we have a service called WorkWest, which is just simply dedicated to helping people find jobs, apprenticeships, traineeships opportunities, and just training in Ealing. So again, this is very short and sweet because this information already exists. So we are just referring people and pointing them in the right direction once they're here in this section. And then we have a section if you're struggling to pay your fuel bills. So this is basically fuel poverty, but we just thought that people might not be aware what fuel poverty is. So we've kind of simplified it, which is something that we try to do with people all the time, just speak in a very plain English, very simple English, because English might not be their first language. It certainly isn't for me. So always, all the time, we're just trying to make it really simple for people so they can get the help they need. So here we're explaining what fuel poverty is and what help we can offer people. Then the next section is childcare, just referring people to a little bit of help and information about childcare and how they can get support, especially through children's centers. And then a really nice section on mental health support, which obviously is something that people need, not only because of COVID, but just in general. Now we have a lovely section already on the website existing, which is basically what I've highlighted here. We are referring people to this section, and then also we are referring people to a partner of ours, GoSat. I know that the representative is here or might be here on this call. I saw in the agenda, especially for mental health in the Black, minority, ethnic and refugee community. I actually would love to catch up with Rahila, especially, of course, all of you, but I noticed Rahila was talking about help to female communities in the female Pakistani communities. What we see very often is that people within certain communities actually don't feel comfortable getting in touch with us. Now, it might be a language barrier, or it might be that they don't feel comfortable talking to the council. So partners like GoSat and, of course, what Rahila is doing are actually key, and we want to talk about them. We want to connect people to their services, because they might not feel comfortable coming to us, but they might feel comfortable going to partners like GoSat or Rahila, people who speak their language and people who understand them. Later on in this document, you're also going to see a section about translation services. You know, a lot of people actually don't speak the language. So my father, for example, I'm Bulgarian, and my father has been living in the UK, not anymore, but he was living in the UK for 10 years. Now, he never managed to actually learn to speak English properly. So I know firsthand experience actually how difficult it is for someone who doesn't speak the language to access services. It might be health services, it might be something else. I think my father was a bit fortunate to have me, so he didn't have a lot of hurdles, but there might be some other people who don't have a family or relative who speaks the language. So the idea of these pages is to include everyone, or at least as many people as possible, and make sure that if they're experiencing some problem, whatever it is, if it's financial problem, if it's domestic abuse help, or if it's something else, we actually get them the support they need. So going into the next section, which is domestic abuse help, we have listed, so we are referring people to our pages, which already exist on our website, but we don't want to lose time, so people might not have the time or opportunity to actually go and click on this link. So we just wanted them to, if they quickly scan this page and this section, we wanted them to see very quickly the names of the organizations that they can help with. And you can see some of them are generic, let's say Women's Aid, some of them are specifically for men, some of them are specifically for women, some of them are for, let's say, LGBT people, or representatives of a certain community, whether it's Eastern European community or maybe Black. So here we also have some other organizations, and you know, the list can be endless. I'm sure that there's some other organizations out there that we actually haven't listed here. So it's all work in progress. We can at least start with this, and then obviously later on we can add more organizations. Then we have access to health services, which is something that currently doesn't exist on our website. So we wanted to make people aware how they can actually go and get registered with the GP, how they can access health services, and especially for people who are not very confident with their English. So if I scroll down, so we have subsections how to register with a GP, specifically sexual health services, which is a little bit of a tricky information to find out there. It's not very obvious. People need to search for it. so I actually attended the previous session, and there were a couple of representatives from Push Doctor, which is a website where people can actually get help online without necessarily going to the surgery. So I've included this. And then, as I said, accessing health services if you're not speaking English. So we are just reassuring people that if they don't speak English and if they don't have a family or friend who can help them, they can actually speak to their surgery and they can book an appointment in their chosen language. And then, of course, as I said earlier, we have a whole section on interpreting services, which is very difficult to find. So obviously, there are a lot of information about coronavirus in difficult languages. But then I was actually struggling to find just obvious and easy to find information about other general services. So if it's not relating to COVID, how can people actually get help if they don't speak English? So I've listed just 3 organizations. I'm sure that there's some others and some more organizations that can help people. So as I said, I can get in touch maybe with Rahila, maybe she'll know where female Pakistani communities in Ealing can get help. And so then we're also referring people to our free English courses. So we, as part of WorkWest, which is the employment and training service, we also have Ealing Adult Learning Service, and we're offering free English courses. So we're just referring people to this. So that's the document in a nutshell, and apologies, I just had to quickly run you through it. I'm sure that we can share this document with you, but I just wanted to let you all know that this is happening hopefully soon, and I just wanted to get your thoughts and views about maybe something we have missed, maybe some other organizations that can be helpful to residents in Ealing.
Thank you so much. Can I just make a few comments? I'm sure people have got lots of questions. I think some people found that quite difficult to read because it was quite small. There's a wealth of, don't apologize, there's a great wealth of information on there. Will you be sending that to Ian or myself so that we can circulate that to the group?
Yes.
That would be amazing. There is so much information, and I was thinking, wow, okay, I didn't know that. So that's great. Also, somebody's asked in the chat, is there any way that they number or email to contact you and your team to talk? So
sure.
if you could put that in the chat for everyone, that would also be amazing. There must be some questions. Has anybody got anything that they would like to ask? I saw Lali, did you put your hand up? Yes. Oh, you've got your mute on, my love.
Hiya, thanks. That was that looks really helpful. Just wanted to double check, when are you kicking it off?
As soon as possible, as soon as it's been signed off. So I've already checked. Obviously, we're working with a wide range of colleagues within the council and outside partners, and obviously a lot of people already contributed. So we are basically hoping to make it live as soon as possible. Maybe this month, April.
Okay. So, I just want, because I'm sorry, I couldn't capture all the content because some of it was really tiny. And I'm sure it's not, I mean, we'll get that, that's no problem. Just wanted to check, what are you having a dedicated one for, say, legal services? People can find legal help?
No, but it's a very good idea. So if you can possibly help me, it's actually a brilliant idea.
We are the law centre, so we've got a vested interest in making sure.
Lovely, thank you. Do you mind if we if I get in touch with you later, Lalit, and then maybe we can work on this? But thank you, it's a brilliant idea. Anything that can help residents in need.
Yeah, I mean, I think lots of times people are looking for lawyers and free legal services or under legal aid, or even paid legal services. They don't know how to find them or where to go.
Brilliant.
So just to get that advice. Yeah.
Thank you.
Thanks, Oli. Shanjit and then Rosita.
I also deal with a lot of Afghanis communities as well, especially ladies, teaching them yoga classes, healthy cooking classes, and many more art and craft clubs and things like that. Also Indian, Asian communities as well, BAME communities as well. It will be really ideal to get a lot of information and, either feed it to the group chat as well, or I can arrange my group if I can have your details, I mean, contact number as well. It'll be much easier to contact you, Eva. If I contact your organization, they might say, go to this one, go to that one, go to that one.
Sure.
It's best to have a direct contact number. Then I can invite you in my group chat. It'll be much quicker to reach these communities and their needs as well.
Okay, perfect. I will get in touch with you. Thank you.
Thank you, darling.
Thanks, Shajit. Rosita, you've got your hand
Yes,
up.
hello, Eva. I couldn't see the list of organizations that are partnering with you, but my own organization, I wonder where they were there. For instance, they provide lots of information and advice, especially around employment and training.
Okay.
EACH, EACH.
Yeah.
Also, Ealing Advisory Service. I mean, they do a similar role to what you have described to be doing by the council. They are run by MENCAP, Ealing MENCAP.
Yeah,
so,
yeah.
I suggest that you make contact with.
Yeah, perfect.
Matt
Thank
Fulham
you.
is the contact person as far as
Thank
I know.
you. So each is not there, but we can plug it in there, Rosita. Thank you. Definitely, I'll be in touch with you, and maybe you can provide a little bit of a content.
Sure, I'd be happy to.
Thank you.
Thank you.
Thank you, Rosita. Rahila, you've got your hand up.
Yeah, hi. Hi, Eva.
Hi.
Thank you so much for this, wonderful presentation and, signposting to different organizations which we can contact. We have got many requests from women regarding even domestic abuse, but, we even cannot signpost them because we are not so confident, how they're gonna do it, because signposting is something which we always feel it may, later on these women, they may get alienated with us because we don't know how the services will be provided. So we would look forward to, get more information how we will get involved, and certainly we would love to work with all the organizations. Thank you.
Perfect. Thank you, Rahila. I can send you some information about what the council says, as a group collectively, what we normally advise. So if you're talking to someone who is experiencing domestic abuse, what's the safest way for you to refer them? So I can send you some information on this.
Yeah, that will be helpful. That will be helpful. Thank you.
No problem.
Thank you. Is there any other questions that I can't see? No. Eva, thank you so much.
Thank you.
For that. That was such a wealth of information. Thank you for your time. If you can share that with everyone, that'd be amazing. And if there's anything that Ealing and Hounslow CVS can do to help you, just get in touch with us.
Thank you.
That's amazing. Thank you so much. We're now going to move on to Shamak, who's already been sort of introduced from Gozad. Shamak, can you hear me?
Yeah, you can hear me?
You're very quiet.
Yeah, because my laptop has been playing up. How is my voice now? Is it better?
Can you make it a little bit louder? Turn yourself up. No?
Better now?
Yes.
Yeah.
Can everyone hear okay?
That's fine.
Great. Welcome.
Thank you very much. My name is Shamak Ediri. I'm from a charity called Golden Opportunity Skills and Development, in short, GOSAD. So basically today I'm going to do a presentation. I know time is not won't be permitted to go through everything, but hopefully we can catch up with people later and through Ian, hopefully. We know the pandemic has affected so many people. And also we know that, what do you call it? There's a lot of debate going on at the moment on race equality in the UK. And also, we know that there's a report that's just been done by the government, but it's getting very contentious on different issues. What's happened is that during the pandemic, GOSAD was working with 5 other BME-led organizations to support over 700 residents in Ealing and also Hounslow, because GOSAD actually is based at the border of Hounslow and Hillingdon and Ealing. So we support clients from other areas. But with these partners, some of them are here. So if it's okay, for them to introduce themselves just before I start, if that's fine. So we have Harriet in the call. Harriet, can you introduce yourself, please?
Yes, I'm Harriet King. I'm from United Anglo-Caribbean Society. And we recently started to collaborate with GOSAD and 4 other associate organizations who are working in the Borough of Ealing. And so this report came about just by us getting together and discussing the effect of COVID on the Black and Asian ethnic minority communities in Ealing. We at United Anglo-Caribbean Society, actually our main focus is on alleviating loneliness and isolation among mainly the elderly, and encouraging intergenerational interaction within the group. So of course, what COVID has done is made our work extremely difficult, because of obviously interaction and coming together is at the heart of what we do. So we've had to reorganize ourselves and find new ways of keeping that contact going and working with people to help them to deal with the present situation. So hopefully before too long, we're able to get back to what we do best and get people out and together and sharing and actually having a life outside of the 4 walls of their homes as they get older. So that's just about a brief summary of us.
Harriet, Yusuf from Hadia. Yusuf, can you?
Yes, Amir, my name is Mr. Yusuf Goured, and I was involved with the charity work from 2011. And then since then, I've worked with a variety of charities. I shared, become some of them to trustees. I worked with partnership, and then from 2007, that is the time I realized the gravity of BIM difficulties, the shortcomings in the service gap, a lot of things I was realizing. I was always on the front line, working with other partnership on how to close the gaps. I was always feeling I was making a difference, and we were making a difference. But when it came to COVID, then I found 2 things came to the front regarding the BIM communities. One was one of contributory. We found that in the NHS frontline services, we got a lot of praise to say these people were doing a good job. And the other thing that we found to the other gravity of the chronic service gap for the most vulnerable society of the community, that we feel that we haven't done anything for them, because on the most vulnerable community, they were suffering for a long time. But when COVID came, we found, because we were eating together food delivery, then when we come to when our volunteers, they were delivering the food, we found some people staying in the dark because they were using the top up electricity. Then some of them, they don't have money, some of them, they're lonely. All these things, we found that we have not been doing enough. So then we said, what can we do? Then we came, 6 of us, to say, this is a long time. This is now the combination of what the BM did on the positive side, and then the sufferings on the other side. How can we close the gap? And that is how we came and produced this report to share with you today.
Thank you, Yusuf. Ian, thank you very much for assisting with the presentation. If you can go to the next slide, please. So this is just the background to conducting this survey or research. So initially, GOSAD wanted to do this by themselves, but then we realized they're working with a few BME-led organizations, and we had some discussions. So this is just some of the background. So at the time, the groups had lost about 25, users, but I think now it's over nearly 70 people who have died from COVID. And this report actually is also for condolences for the families and remembering them. Also, the COVID-19 has exposed and brought a lot of deep-seated inequalities that have continued to disproportionately affect the BME communities. So the groups actually, they've been working in and around Ealing and other areas for more than 100 years. But also the groups, we found that when I was doing this actually research and survey, I found that actually these BME-led organizations were also experiencing a lot of inequalities themselves. So this report actually looks at the BME community and also BME-led organizations and the challenges they face. Thank you. Ian, next slide, please. So these are the 6 organizations. So GOSAD, United Anglo-Caribbean Society, Ealing Somali Welfare and Cultural Association. So the United Anglo-Caribbean, for example, Society was set up in early 70s. But up to now, for example, they haven't got a base because they've been moved from place to place. It just shows you some of the inequalities. The Ealing Somali Welfare and Cultural Association was set up in the early 90s, and they were responsible to settling a lot of Somali refugees in West London. It was actually led by a seaman, a Somali seaman who came to the UK when he was 18 years old. Then you got the Tamil Community Center. They work very closely with the Tamil community across actually West London. The KM Women and Girls Development Association. They work mostly with the African community, mostly from West Africa, and then Horn of Africa Disability and Elder Association. And this is Hadea. You just heard from Yusuf. Next slide again, please. So a total of 342 BME residents were surveyed by the organizations. So the way we decided to do the survey was a bit innovative because we were working together, doing things like food delivery, trying to do telephone befriending, just dealing with COVID itself. So we use those opportunities. For example, doing outreach work to do the surveys, and also we use other methods like bulk texting, using online platforms. So we're able to reach out to 342 residents. So some of these residents live in Hillingdon, some of them live in Hounslow. So it's actually almost cross-borough. Next slide, please. Yeah. So these are the kind of some of the key findings of the survey. The highest number of participants that took part in the survey were aged between 46 years and 65 years. More than 300 participants have indicated that COVID-19 has negatively affected their mental health state. And just over 250 participants each know someone that has died as a direct result of contracting COVID-19. So that's a big number, so 250 people. And also we know there's been a lot of issues around bereavement, which we are still trying to grapple with, because what's happened with a lot of organizations like maybe yours, you are encountered by, individuals who didn't get any kind of bereavement support. So that's another service that we have developed, but we want to develop further. 250 and more than 100 participants have indicated that they require mental health and well-being support and support to understand up-to-date official COVID-19 instructions. Now, we just heard the other day about the one of the vaccinations with clotting, blood clotting, and it's an issue. So, for example, we're doing some work with each around track and trace, and constantly we have to, the messages, they're coming at different times. They keep changing. We have to all the time support some of our clients, and because we sometimes we deal with people who English not their first language, So it means sometimes you have to do extra work to make sure that they get the messages. So the issue around mental health came out very strongly, and it's something that unfortunately we are seeing a lot of issues, as Harry, for example, mentioned. People being stuck at home. We go cases where actually people don't want to come out completely of their, even actually from the last lockdown, that people are still indoors. They don't want to come out. Next slide, please, Ian. So these are the kind of 5 things we came up with that I think all of us, hopefully can work around. So the first one is about health and social care inequalities. So in our report, we'll give some examples, and hopefully Ian will be able to share the report with everybody. There's issues around housing and welfare rights, and is it Iva from the council was talking about the services that needs to be provided. So we know, for example, a lot of people, for example, had to be rehoused because of COVID, and this was a government directive. And unfortunately, all those homeless people, who for the first time they got very good support. We knew like in October, they had to come out of those properties. So there was no plans put in place by a lot of local authorities to support them, and those people end up actually coming to organizations like ours for support. Then there's the issue around local policies and strategies, and then bridging the digital divide. Now, with that presentation from the council, we know a lot of people still struggle to go online. So we have to do as much as we can to support that kind of digital gaps and divide. And support for recognition of BME-led organizations. Again, there's been a lot of examples of how these organizations have and continue to suffer. So regardless of, not getting funding, we know that they're still out there supporting users. Now, if Ian, go to the next slide, please. I think because of time, I'll just try maybe to just go through this quickly. So under the first theme of health and social care inequalities, calling for effective communication by involving BME organizations and individuals in developing and disseminating COVID-19 related health and safety measures, calling for improved customer care by health and social care providers when dealing with families and friends or BME individuals who have contracted COVID. Now, we had a lot of cases where, for example, at the beginning, families were struggling to get information for their relatives who've been admitted in hospital. We know the NHS was struggling at the beginning. So unfortunately, it took sometimes to make complaint through the PALS system for somebody actually to contact families, telling them, giving them updates about their relatives, calling for change in the way mental health services are currently being delivered. We've done a lot of surveys in the past. We know a lot of services are not appropriate for a lot of BME communities. We've identified, for example, the IAP services, which we know is not accessed by some of the individuals with language issues. Calling for health and social care providers to work closely with BME organizations and individuals in fighting the scourge of inequalities in COVID-19. Now, we know there's a lot of consultations, a lot of efforts. For example, with the mental health services at the moment, you've got the MINT process. It's a very good process because where mental health is looked at, but we found also that a lot of organizations are not involved. We had to find out about the MINT process to be involved in it. So I think more needs to be done. Next slide, please. So housing and welfare rights. When COVID happened, a lot of people were put on program by the government where the furlough system. Now, unfortunately, we found a lot of the BME staff members in October, they actually lost their jobs, and a lot of people had to go on universal credit. So it's organizations like ours, like the Afro-Caribbean organization, that had to support these people to apply for universal credit. And some of these people were really desperate, and we knew, and most of you know about this, that it took a long time for some of them to get the money. And of course, during that time, things were very difficult for them. So we are calling for proper scrutiny of council's housing policies on approving private temporary accommodation properties and the need for children and other social services to be involved in cases where children and vulnerable adults are involved. So we found a lot of people from the BMA communities, they are, very overcrowded accommodations. Also, we found that sometimes even with the council, there's a rush to put them on temporary accommodation, which hasn't been properly checked. So we had, for example, a family where they are put in a temporary accommodation, 4 kids, and there's no window in the property. So the council needs to do more. We also call on the local authority to review its temporary accommodation policy and procedures. Again, this is similar to the previous points. Calling for social housing providers and the local authority to do better.
Sorry to interrupt. If anyone's got their, could they turn their mutes off because it's slightly interrupting with the sound? If you could do that, thank you very much, everyone.
Yeah, I can hear somebody. Yeah. Ian, hello. Ian, can you put back the presentation if you don't mind? Yeah, thank you. So these are the kind of points around housing and welfare rights. And because of time, I think I don't want to take too much time. So I'll go to the next slide, but we'll share all this.
Saying that's the end of it.
Is that the end? Yeah. Okay. Thanks. Yeah. Thanks. Yeah. So this report will be shared with everybody, and actually we're doing a follow-up at the moment. So we're working on a follow-up process. So if anybody has any questions, feel free to ask, please. Thank you very much.
Mac, thank you so much. That's really amazing. Omar, you have got your hand up. Would you like to ask a question?
Good morning, everyone. Sharmaki, just wanted to ask you is the survey you did on, is it only within Ealing or you combined with Hounslow?
Hello, can you hear me?
Yeah. The survey you did about the BME, the COVID impact, was it only Ealing or you included in Hounslow?
Yeah, so GOSAD is based at the border of Ealing, Hounslow and Ealing. So we had a lot of people, for example, from the Covent Way estate. Yeah, so it's those are a kind of cross-pollination in terms of the process. So we had a few people from Hillingdon, and I think about roughly maybe 30 people from Hounslow that took
thanks. Because I think the impact on the COVID, as you know, especially the Somali community has been severe. And the other thing is about the housing issue. And you know me, we've been talking about it. And I think the Hounslow is the most notorious when it comes to the housing. At the moment, even you make a complaint directly, even if you ask for the independent tribunal, they don't even refer you. So I think Hounslow has become one of, at the moment when it comes to dealing with the BME, with the housing issue, I think but with the health sector, I think they are better because even today, I was trying to help them with the vaccine, the drop-in clinic. They have contacted me, and I was, taking them around the mosque and making some announcement for them. They will be doing let me exactly, if I can share with you, and you can probably share with other people. They're doing this one. They've sent me this one. Okay, I will put this one in our chat. So if Sharmaki, you can share it, because specifically it's for the Somali community who live these areas. They will be bringing in mobile clinics. So they will be taking it, actually, the vaccine to the states at the moment to try to vaccinate them. So if anybody out there, you can share this one. I think it's on Tuesday. Tuesday from 10 o'clock to 2 o'clock. So please, if you can share around, that would be great.
Yeah, thank you, Omar. I think the question you talked about around housing and is not easy. And I think we have somebody here from the council. There are a few people from the council. One of the things we want to do with this report is we are going to be running sessions. For example, this session, it looks at the BME communities, but mostly people who are here are professionals. So our plan is actually to do this kind of sessions. We're already doing it with our users, where we bring the users with real issues, and we look at different themes. For example, housing, welfare, COVID, and just to hear from them directly the issues that they face and the solutions. And also we can bring, and then we share that with professionals and see how we can work together. Because what's happening with housing, for example, is one of the biggest issue everywhere.
Yeah, Hanslow, yes.
Yeah, and it's because of more people now needing properties, and councils maybe they're overwhelmed.
No, actually, Hanslow, they ignore people. The biggest problem with Hanslow is I think they are above the law when it comes to the housing issue. Yeah, they normally, because to ask for the last bit, when you make the complaint, the procedures are there, you follow them, and you send them an email, they don't reply you. And it's just that it's been like that for the past. I think Hanslow housing issue has, especially when it comes to the BME and the Somali community, they ignore them completely, because it's something that I know and how many people have you tried to help them with the housing issue that have been, it's something. So we'd love to continue this discussion with you.
We'll do another program.
Yes.
Because from GOSAD and others, we build a lot of expertise in how.
Yeah, my community is running at the moment, Sir Marky. You know that it's in Hanslow Central behind it. I told you. So anytime, drop it, and you have my number there. So, but with the housing issue, there is a lot of people in Hanslow who are suffering. At the Hanslow housing.
Just to say that Ealing and Hounslow CVS actually has a specific project to work with BAME groups to improve the housing situation. So I'll put you in touch with my colleague Toby, who's actually running that project.
Honestly, that would be great, because at the moment, I'm not even talking about somebody else. I'm talking about myself. I've been trying to get a housing from Hanslow for the last 15 years. The MPs were involved. The councillors were involved. The last minute, they told me, if you want private tribunal, we will send it to you. For the last 3 months, I've been sending them an email asking for even that. They don't respond to you. I have all the evidence. So, and the people who are coming to me asking for help, and how can you help them when myself, they're not able to do that for me. So as a guy who was disabled, was given, and I was given the highest priority of housing. I was given the highest occupational therapist, and with the help that I can get from other MPs and councillors, and they have all of them, they've ignored them. And specifically when you're Somali, they will ignore you as just like that as possible. So it's Hanslow is a place whereby at the moment the housing, we have an issue with it. So if you can connect me with Toby, I'll appreciate it.
Thank you, Omar. Yeah, we'll have to do some more work.
No worries.
Yeah. Omar, thank you so much. Wong, you had your hand up, but you've taken it down. Do you still want to talk?
No. I'll take it out. Sorry.
That's all right. No. Does anyone else have any questions? No?
I think somebody put up their hands, but I don't know who.
Yeah, no, I think
that's me.
It was one. So,
yeah. No, it's fine. It's just that I think sometimes we can get very engrossed in personal matters and mixing it with a group matters. There are helps available. There are groups available, as I understand it. I know I haven't been involved in a lot in the Ealing sector for a very long time. Partly, I don't work for Ealing CVS anymore, and also I worked abroad. But we really have to be objectives about what we try to do with other groups, rather than just look at individual personal matters and mixing it with the community matters. Yes, there are lots of issues with various councils, both Ealing, Hounslow, Hillingdon, whichever. But we have to be a little bit more objective and try and stand back and look at the bigger picture. Yes, we can try to help everybody, but not everything we could do are enough. We can take a horse to a trough, but we can't force them to drink water. And that's what I found in the past with some individuals who we try to help and do our best, and we spend a lot of time focusing on something that maybe the person don't want our help, and they feel as though their personal pride, whatever personal situation. That's all I want to say. I'm not attacking anybody. I just want to say as a general point, that there are lots of really good groups, like GOSAD and others, the Anglo-Caribbean Society, which John started, and unfortunately he's no longer with us with the group. But there are lots of groups. Ealing CVS with the infrastructure help, both in Ealing and Hounslow. I'm not selling them because I don't work for them anymore.
Well, you can sell us. That's absolutely fine. We like being sold.
Yeah. Wong, do you have any particular question? Your points are very important.
Yeah, my question is, is there any particular stats and statistic that we could use that's independent, rather than hearsay? And I know at the front line there's a lot of issue with BNE support and all that stuff, but at the same time there's also skepticism with BNE regarding the COVID vaccines, and there's a low take up on it. And I think it is very important that how other groups, all the groups in Ealing and Hounslow, trying to encourage their community to take up the vaccine.
Yes, I think I get the point. So there's a project at the moment with each is leading on this, on track and trace. So GOSAD is part of that, and we've used a kind of community approach, we have Rosita here, who can maybe another time maybe present, I think the challenges, I think what I can get from Wong, what you're saying is that so the challenges we have is not about, and also the issue around the BME, because in our report we talked about not lumping all the communities together, because it's about equity. It's about looking at different communities who might present different issues. For example, in Ealing, and I think Hounslow, there's a lot of Syrians who just settled, come from Syria, and they will have different needs compared to maybe the Somali communities who maybe settled slightly longer than them. Yeah, so and the challenges also is about looking at how these communities want support, because the issue, for example, about vaccine hesitation is mostly around a lack of information, or there's a lot of what you call, again, fake news, so people are receiving a lot of information from, like on WhatsApp from other parts of the world, where maybe people speak their languages, and people, hope kind of slightly trying to trust that kind of information. Yeah, so there's a lot of work that needs to be done, and I think it's by everybody working together, by everybody including different communities or different people, in kind of when they're shaping up their projects. I think that's quite important. I think, is it Rahila?
Thank you for that. Can I just put for the purpose of the group, Wong, can you just say which organisation do you represent?
Are you talking to me?
I am, sorry. Yes, yeah. I've just got
Okay.
Wong and a flag.
Yeah. No, it's actually James Wong.
James, thank you.
Yeah, he used to be known as Jim Wong. Yeah, I work for KISS, Community IT and Technical Services. So what I used to do, less so recently, is to support group with IT services, independent advice. I don't get any money for it. I don't take any money from anybody. Mm-hmm. I've been in IT in my past as a professional for over 23 years before I became a teacher in, again, ICT, right? And I teach, I'm a full-time teacher. But on the side, what I do is I can support groups. The Armenian group in Acton, I helped them recently in a recent project with them, with a lot of infrastructure work, helping them with the, any advice on IT and technical services, including telephone, VPN. I can give you independent advice without charging you anything. And I'm not funded by anybody at the moment.
James, thank you so much. It's just that's really helpful for me. Any questions, anybody? Before? Oh, Warrior,
Rogers,
you've got your. There we go. Sorry, Rogers.
Thank you, Shamak, for your report, which you identified with. But I just wanted to make a comment on what Wong said there. I think you talked of stats, and if there is this just hearsay or there are stats, I would like to point you to some very good reports that have been run by Runnymede Trust on the impact of COVID on the BME communities, also a good report. And also, there's also a report with another research organization, UKRI, also which talks about that. So it can corroborate some of the issues Shamaki has just highlighted, so that's also an independent organization that can also link into that. So I just wanted to bring that to say that I don't think all the issues Shamak report brought about are just hearsay. They actually interviewed people, and those are lived experiences. So I think we can relate that to whatever independent reports have been done by others. Thank you.
One more question, Harriet.
Yes, just quickly, I wish to correct something that Wong said, that John Swan was founded, United Anglo-Caribbean Society didn't. He's been a chair for a long time and did the job extremely well, and I give him that. But can I just, for the record, that United Anglo-Caribbean Society was started about 49 years ago by a group of Caribbean people who came together to set the organization on track. So that's just a small fact. But I'd also like to say on the question of, sorry?
Apologies.
Yeah, on the question of statistics, this is very typical of the problems we face, that when we as a people say this is happening to us, it is questioned. If somebody else says it's happening to us, they're believed. So can we start listening to the people affected by the issues sometimes and not dismiss them because they haven't got the statistics? Sorry.
Yeah, you know, can I say something? I thought Wong was just making a general, when you say that, I think, I just want to get clarity from him. Wong, are you talking about the research we've done or just talking about something else?
I think with all communities, we all need these stats and figures because funders will be looking at that rather than our, you know, sometimes we could get engrossed in our own personal situations and work.
Yeah, let me
but I mean, in general, I think for funding purpose, I think it would be good to have these, like the Runnymede Trust research that someone recently just mentioned, and others. Then that's a bit of a good way to apply for fundings, and you know, and then funders won't sort of dismiss it and say, oh yeah, just hearsay and all that. You know, having good facts and independent, so you know, stats. Yeah, that's what I'm saying.
Let me correct you. Yeah. So basically, I think it's quite disappointing to hear from someone like you who said you worked for the CVS. So basically, personally, I have over 25 years experience. I might look young in the sector. I've done infrastructure work, and this research is being done by 6 BME-led organizations. We've got the statistics, we've got everything. So if you are questioning that, then I think, you know, everything you're trying to say about working with groups, or, you know, then it looks like you don't really mean it. And also it looks like, you know, maybe even your time at the CVS maybe wasn't useful to groups. I'm sorry to say that, because again, I'm not just, you know, attacking you or something. Yeah, so, you know, it's quite, you know, if you want to have maybe conversations with us or me, I'll welcome you to do that. And you can share our reports and you can look at our statistics if you want. You're welcome. Yeah, so I just wanted to make that clear to you, Wong.
Yeah, and I mean, I think funders are quite happy to see groups doing their own qualitative research. It's they're keen to hear that. It's not simply a question of you must have quantitative research from, you know, official sources. Funders are very happy to see groups do their own research.
Also, we did this not because of funding, actually. We did this to highlight the existing inequalities, and we've done it also to highlight what's happening during the pandemic, you know. And I think the problem is that sometimes you've got people who associate themselves as from the BME communities, you know, who unfortunately also, I mean, we've got the Sewell report at the moment. This is somebody who denied there's been institutional racism and has been given opportunity to, you know, to work on a report which actually now denies there's institutional racism. And unfortunately, these are the things that sometimes you have to push back on. And for me, sorry about this presentation, but I'll always stand up for what's happening. And I think when you have consenting voices, sometimes it's good to have conversations, because it's very important to do that.
John, thank you very much. Never apologise for the work you do. That's just for me, not for Ealing and Hounslow CVS. I know this has gone on longer, but this is actually an important discussion. Would you mind taking another question, Shamak? Janet would like to speak. Her hand's been up for a little while. Do you still want to speak, Janet?
Yes, I'm here. I really just did want to point out, I mean, there's nothing wrong, first of all, to acknowledge Wong's sort of statement, because what it has done, it has actually sort of raised eyebrows to the exact things that we get bogged down with, first of all, because when you talk about inequality, and I would appreciate Harriet King's comment, we start looking at figures. No research under whatsoever, under what circumstances, must only focus on quantitative. And no research must only focus on qualitative. You can even do a combination of both, and they are all equally valid. And as long as the interpretation is correct, the methodology is up to what it is supposed to achieve, this is what is important. When you are raising an issue, not all issues can be measured. I mean, we are talking about mental health here. It annoys me when I sit in a group of this nature, whereby people are sort of paying attention and they know what is going on. You can't measure mental health. How would you find numbers and figures and go into people's brain and sort of put numbers and figures into what is happening in terms of the impact that people are experiencing from COVID? It's not possible to happen. You would have to talk to people. You would have to establish exactly what is going on in terms of what they are telling you. And now if you fail to trust what somebody is telling you in regards to the impact they're experiencing from COVID, and you're looking for numbers, that is just not on. And so as much as I appreciate all the comments, it is valid. I mean, don't get me wrong, but we need to really move away, because this is how this inequality carries on. And we continue to cause a lot of detriment to ourselves and failing to focus on the issue that we so much need to address at the time that we need to deal with them when they are happening at this time in present. That was just my comment.
Janet, thank you very much. Lalit, would you like to? Your little hand doesn't work, does it? Your real hand does, but yeah.
Yeah, it's my real hand up. Yeah. So, yeah, just sort of to come into this conversation. It says I'm saying this on a personal level here, and not like as a representative of Ealing Law Centre. It's a very challenging landscape in terms of funders and in terms of putting forward the issues that the BMA community is facing. So I don't think I didn't understand Wong as saying, well, no, whatever's been said by Shamak is wrong. He's just saying, did we have also the numbers? That's how I understood it. And I think everyone's already made the point that, yeah, it's challenging, to get the numbers, and we should be believed on the face of what's, we should be trusted as a community, we should be trusted. And I think the question is more about how we present ourselves to, gain that trust and to gain that respect, and sort of, as a starting point to say, well, actually, this is one of the challenges that we face is, we have to back up everything with numbers. There's, if you walk around, there's evidence, the council's got evidence, there's evidence everywhere, and we're just going into the heart of the community and we're bringing you more evidence of what we've discovered, with the tools available to us. And, we may not have the same high-tech databases and the computers and the IT that the council or other organizations got available to them. And I think that's really about the conversation and working as a group, and just always working on a base of, like, when somebody's putting forward something, it's from maybe their experience and trust, and they're putting it forward as a helpful comment, as opposed to challenging. If we don't work together ourselves, don't trust each other ourselves, it's going to be harder to present ourselves as a trusted face forward. Just as a, you know, it's I think the conversation got a bit heated, whereas I think it could, you know, I think everyone's trying to work together and say, look, this is what the fund is going to be looking for, this is what we found, and this is what the issue, and they're very, very serious issues. And there were some really important pointers about, you know, Toby's working on this, Ealing CVS is working on this, and that's where we need to put our sources together, really. That's my personal perspective there. Yeah.
Thank you, Lalit. Look, I'm aware that I've done a very appalling job hosting. We've gone to 12:20. I would just like to thank Sharmak. Thank you so much for your time and your presentation. Hamza's gone, but I want to thank him from all of us. And Eva, I think she might have left, and I want to thank her. And more importantly, I'd like to also thank everyone for attending these. And sometimes a heated debate can be a good thing. Sometimes things can come out of it. But I think what you said, we all need to stick together because we're all working with the same causes. So I'm going to leave you with lots of love and lots of light. And thank you so much for joining, and see you next week, hopefully.
Thank you.
Just last comment. Ian, hopefully you can share the report to everybody. And, you know, if anybody wants further, if they have any further questions, please, they should feel free to, you know, to email me, or any of the organizations that are included in the report. Thank you very much.
Thank you, Shuma. Bye.
Parul, hello.
Yes.
Hi, just a bit of good news. I'm meeting with a lady from Hounslow Council on Tuesday with about women-only swimming sessions.
Oh, fantastic.
I think I'm getting somewhere.
Oh, Lisa, I'm so delighted. You're really getting there. And when I saw your website, I was so thrilled.
Oh gosh, that's like
amazing.
Yeah, so amazing. Like, yeah, so thank you everyone. CBS, yeah, thank you for Jane. And
oh, isn't she is
brilliant.
a godsend.
Mike is an absolutely, yeah, fantastic. He's just like a workhorse. And
delighted.
Yeah, you can tell he's really, really passionate. Like, I'm really, really passionate about swimming. He's really, really passionate about what he does, you know, with his web design. So I think he really enjoyed it as well. So
I'm so happy.
Yeah,
and
yeah.
I think I don't know if it's just me, but I feel that you've just like the shape of everything is getting much more solid for you. Things have been moving forward for you.
Yeah, yeah. So it's been like months and months of just like exhausting and just like, you know, putting your voice out there and trying to be heard and everything. And I still feel like I do have my days of like, oh, but then I get like emails that and it was a lady it was Sarah State from the Ealing, she the NHS that she works for, then sees Ealing and Hounslow CCG. She was the one who put me in touch with this lady in Hounslow. And then I've also said that I'm on the social prescribing training program for Northwest London. And she went, oh, you know, that's really great. So that organisation, they are going to put me in touch with link workers because yeah, just be able to offer as much, you know, swimming service for as many organisations as possible. So yeah, so that's a little bit of a positive note to end.
You've done good, girl.
It's like everyone, it's so frustrating when your story is very real for you. And I'm, you know, going on my mental health first aid courses. I'm a practitioner for youth and adults. You know, how mental health manifests, it's by not being heard, and your experiences not being validated, and then you internalize that, and then that's how all these other things manifest. And this is how the despair and the destruction happens. So, you know, but the CVS, you're fantastic because you listen and you validate each and one of us. And that has just been, it's been an absolute lifeline for me, because especially, you know, swimming coaching, it's really, really lonely. It breaks up swimming coaching, you know, especially swimming coaches, you know, you have family breakdowns because of the, you know, intensity of it all. And you do feel very, very lonely, but, you know, you've been a fantastic, every one of you have been a fantastic support for me. So thank you ever so much.
No, thank you for saying that, Lisa. I'll let the team know.
Oh no, you've been absolutely brilliant. Absolutely.
Thank you.
Brilliant. So thank you.
And I'll see you soon. We'll have.
We'll see you next week. Yeah,
absolutely. Thank you so much. Take care.